Dr. Emily Durbin, you are an associate professor of psychology at Michigan State University and the author of Depression 101. What are some of the misconceptions about depression?
I think there are several, many of which emerge from how people most commonly hear about depression in our culture from the popular media. So one common misconception concerns bipolar disorder, where people often think that individuals who have this condition swing wildly between periods of time in which they're elated and manic, and then immediately experience periods in which they're profoundly depressed, and that the common pattern for individuals with this disorder is to cycle across these two experiences. And in fact, that's fairly uncommon for people with bipolar disorder. And the depictions of how people behave in these states that are in the popular media are often much more florid than what we see. They're typically presented in a way that's not as nuanced as what most people with manic depression or bipolar disorder experience. That's one common misconception. I think the second that also gets propagated, not only in our popular media, but sometimes in the lay scientific press, is the idea that depressive disorders emerge from a quote, chemical imbalance in the brain. And while I want to acknowledge, and I think it's important for people to understand that we do know that neurotransmitters and brain mechanisms are critically important to understanding the causes and manifestations of mood disorders, the idea of an imbalance between different chemicals in the brain producing depressive episodes or manic episodes is really an oversimplification of what's happening. Scientists are working very hard to understand exactly how neurotransmitters, brain circuits, genes, and other biological mechanisms are responsible for producing what we see in depression, but the simple idea that there's too much or too little of one or more neurotransmitters is not a good representation of what we know about how depression occurs. And I think the last misconception that people often have is that if the person who is experiencing a depressive or manic episode can recently remember having experienced something stressful in their life, that the stressful life event is necessarily the cause of either that manic or depressive episode.